So that is one of the primary reasons that people will want to start the CGM system is because A1Cs are high. They originally came about actually to decrease hypoglycemia. Those were primary indicators for their first use, was to prevent low blood sugars, used a lot for hypoglycemia unawareness, where patients do not get symptoms of low blood sugars and their blood sugar is already 40. So it does decrease hypoglycemia. The newest thing is time in range, and I'll show you some reports and talk about this a little bit more in detail and how this has become more important than even an A1C. CGMs also reduce hospitalizations through less DKAs and less hypoglycemia as well. It also reduces absenteeism from work, and in turn, also patients are more satisfied with their treatment and have a better quality of life. The final part of a CGM, which is becoming more and more important with these CGMs, is that these are being helped to introduce closed loop systems with pumps in this artificial pancreas thought process that is in the works. And algorithms have been developed to use continuous glucose monitors to feed into the pump to give them blood sugar readings, and then through an algorithm allow insulin titrations via the pump. Now, the Libre does not have this capability, but CGMs in general, some of them, and we'll talk about the Dexcom and Medtronic, have this capability. Next slide. So this is a picture of what I was trying to explain to you, that there is the finger stick numbers there. You can see them by the dots. And then on the right, you can still see those finger sticks or those scan marks, but then you see the waveform that gives the continuous monitoring of the highs and lows. So on the left is the snapshot, and it looks like actually everything is perfect. All hours of the day, not had a single problem. Blood sugars are between 70 or 60, it looks like they're on the left, and as high as 120, no problems. But CGMs on the right show you how many problems are occurring throughout that 24-hour period of time. You can see the reds, that's below, meaning hypoglycemia, and you can see the severe rises that are the yellows, and there are periods of time which are good. So that's how the story is told, is through those continuous monitoring. Next slide. So I said time in range versus A1C. A1Cs are excellent and have been the hallmark to monitoring blood glucose levels for patients. But this picture shows you that patient A has an A1C of 7%, and the time in range is also 100%. Time in range is considered anything with a blood sugar between 70 and 180, and you want this time in range to be greater than 75% of the time. So time in range has become more of, for me in my practice, and probably moving forward, where we'll see this actually change in some of the guidelines through the ADA, that in range will become a standard of care as well. Because you can see then in patient B also has the same exact A1C, but you see there's about an 8% hypoglycemia. We want this to be less than 1%. And you can see that there is over 29%, or 29% is the hyperglycemia, meaning above 180. So even though this patient's A1C is great, you are not getting the picture of low blood sugars, even though a perfect A1C. And then patient C is even more not as well off as patient A and B, because the hyperglycemia is now 58% of the time, but more importantly, having extreme hypoglycemia less 18% of the time. And again, you want that to be less than 1%. So all of these patients have A1Cs that are excellent, but the picture and the what's going on with the patient is actually not the same. Next slide. This is just some of the equipment that the Freestyle Libre has. On the far left is the application, the insertion to be able to put the sensor on. You can see one of the receivers are there, and some of the equipment that we use or the patient has on initial setup. So we'll talk about the Libre system. Next slide. The Libre actually started out as originally a 10-day system. And this 10-day system was blood sugars on demand. So that was just, you scan it using the reader. At that point, there was no phone, and then gave you your blood sugar reading. So it was more of a snapshot and starting to show the progression of blood sugars with scanning the device. So then it also came out with the 14-day system. This was to actually make it more wearing of the sensor for a longer period of time, but not too much change besides the day extending as far as being able to wear it for a longer period of time. The Libre 2, though, now has the ability to read, tell their patients to cross a threshold, and that's when the alarms actually started. So in the other ones, we were not seeing alarms. And this is Libre 2 is when we were starting to receive alarms, and that was becoming more similar to other continuous monitoring systems. Libre 3 is the most and the newest one that is out, and that's why I chose to speak about this today, is because it is now on the market here in the United States, and we've been actually prescribing it and have here in our clinic. So this one is the most like the Dextones, continuous glucose monitoring. It shows blood sugars without scanning, and also has that same exact alerts that when your blood sugar crosses a certain threshold that you put in, that it will actually alarm for you. So that is the difference, or the progression of Libre 3. Libre, or from the original Libre to now Libre 3. Libre 3 system is the world's smallest one that's out there. It's the thinnest glucose monitor. And to tell your patients, it's about the size of 2 stacked pennies on top of each other. The Libre is touted as the most affordable out there. Libre 3 is made by Abbott, and they have now made from 2 to Libre 3. There actually is not a price change, so it doesn't matter which one they get, but the cost is still the same. So that's pretty impressive, because the scanning has now been removed from the Libre 2 to the Libre 3. The 14-day accuracy, this is just touted. This is more coming from the Libre themselves. Abbott's company saying that they have the 14-day accuracy. It is for adults, has this mean absolute relative difference, and it's 9.2% in adults. I didn't put it on the slide, but children is still around 8.5%. So they are also sustainable. Everyone is kind of into this now as far as how do you get rid of this stuff, and is it safe for the environment? And so it is a reduction of plastic, and actually the Libre 3, I've seen it in their cartons, and they are super tiny as far as that. So there's a 43% reduction in paper products whenever they're making it. Next slide. So glucose monitoring, there are reports that we get, and I'm going to show you just a few of them that come from the Libre, and it's called Libre View. And these are reports that give recommendations through the report that you can advise the patient on. And they are lifestyle considerations that you can tell about, also giving you that you should look at medications and that type of thing. But what I want you to see most importantly on this first one, this glucose pattern insight, and they call it a GPI. And it's that time in range. You can see on the left-hand side, it's 70 to 180. And on this patient for a 2-week period of time, you can see the dates there in the top, it's 65%. So goal is 75%. And then you can see where the lows and the highs are. And it also gives you on the right where it says a GMI, and that's basically a kind of an algorithm to figure out an approximate A1C for this patient as well. You can see in the middle the considerations, so it does give you, as a clinician, some guidelines and stuff like that. But then you can see in the bottom where you basically get that time in range report printed out in more of a graphic form for you, so that you can see where the lows are and where the highs are, from midnight being on your far left till 11, 12 p.m. midnight, again on your far right. So a 24-hour period of time, and you'll be able to assess where some of the problems are. Next slide. So this is one of my favorites, and it's called the weekly summary. So everything on that previous slide was showing everything kind of all smushed together over an entire 2-week period of time. This page is the weekly summary, so you actually get 2 pages 1 week at a time. And depending on what your patients put in for you, you have tons of information here. So just on this one, they put in the total carbs. You can see those little yellow boxes. That is for the carbs that they ate for that meal. Now there is, if you look, you can see on the right-hand side, it has carbs. It gives the total. And then on the graphic sheet gives the individual amount of carbs. So you actually are able to see if they're eating high carb meals or low carb meals and what is actually occurring from eating those high carb meals. So again, it'll help you with determining insulin doses. Now this patient didn't put in, it says rapid acting insulin, and then it says long acting insulin there on the right-hand side. Patients actually can put in the amount of insulin if they also would choose to, and then you know how they dose themselves as well. So again, it's the far left is your midnight and moving throughout and across the day. So you can see where hypoglycemia is occurring on this patient is on Monday, March 12th. And you can see it actually was really riding super low pretty much from maybe 4 or 5 in the morning, the whole way until close to probably 9 o'clock in the morning, riding super, super low. So, and I say super low, less than 70, I shouldn't say super low. So these individual days will come up on your reports that you can find out problematic days and kind of talk through with your patient a little bit better on what's going on. Next slide is another one I like to look at. So this one is called a snapshot. And this one I look at specifically because of lows. Remember, hypoglycemia prevention is one of the key things of CGM monitoring. So this one gives me good graphics on where these lows are occurring. You can see they're happening shortly after midnight, and they're definitely going less than 60 around that time. And then you can see between the 3 and probably 9 o'clock hour running at least somewhere between 60 and 70, so on the low side. And then you can also see again before dinner running pretty low, hitting down close to the 50 mark. So just another way, it just depends on how your eyes and what you like to read. It's what's great about a lot of these CGM reports, depending upon which company, but they give you lots of different ways to assess sugars, and you just find out which one works best for you. Next slide. Sensors aren't perfect, so can they be inaccurate? Absolutely. And sensor glucose readings should have a finger stick if you feel like there is a reason for inaccuracy. So sensor glucose readings may not be accurate for several of these reasons. So the number one I tell patient is when symptoms are not matching the sensor reading. So if they are 60 and they don't feel sweaty and they don't feel shaky and they feel perfectly normal and not sure why this sensor would be reading 60, then it would be very important to do a meter blood glucose reading to make sure they're not 60. Usually sensors run and lag behind about 10 minutes, somewhere between, they're trying to get more accurate on this, but somewhere around 10 to 15 minutes. The other thing that can happen is that they might have symptoms and it says they're 90. So that's another issue. So now they're sweaty and shaky and it says they're 90 and the arrow says it's going across, but they already feel like they're hypoglycemic. So that would be another reason to test. So basically when you don't and aren't sure that the sensor is equaling the symptoms, be it low or high. And then the first 12 hours of a Libre warm-up, they should be doing meter checks. So the first 12 hours have inaccuracy. And also, I'll tell this later, but they also take an hour to warm up, so you don't even get readings in the first hour of a CGM for the freestyle. Other reasons that the CGM can be inaccurate is due to rapid fluctuations in blood sugars. So it just can get off for periods of time. So even though it might be off today by 20 or 30 points, that's actually considered an average or an okay number, but patients will say, well, it's dead nuts on, it's, it's never been 20 or 30 points off. And usually that's because they haven't experienced any rapidly changing blood sugar readings. So if they do more than 2 milligrams per minute, many times the CGM will actually become off. So I already said this one, when the sensor readings don't match the symptoms. Also, sometimes you can scan it and it doesn't give you a number. Sometimes you scan it, it gives you a number, but it doesn't give you an arrow. And again, those are times where you should actually be checking with blood. And then confirming hypoglycemia. You don't want anyone ever passing out for low blood sugar. So I also tell them, if they're having symptoms, the meter says they're less than 65 and they're having symptoms, they need to treat their low first, and then they can obviously check their sugar after that. So they need to be sensible, as well as when, checking your sugar can take a little bit more time. Next slide. The biggest thing is, I've already said, it's up to 14 days there. You need to watch patients have some sensitivities to the glue and the tape, and that happens continuously. Moving sites is really important on different aspects of the back of the arm, because that's the only approved place on the Libre to use it. But this can happen. So using sometimes hydrocortisone cream and putting that on in the area that they're going to apply it, let it dry and get super dry before they actually then clean their skin and try. We've done those types of things. But sensitivity can definitely be an issue with any of these sensors. Falling off can also be an issue for patients, as far as not sticking. So we do use Mastazole at times, and many times it's actually just due to exercise and sweating. So sometimes that is a hurdle that is difficult to get over. The other things that you should know about this sensor is that not anymore with the Libre 3, but Libre 2s and down, you do need to be scanning your sensor at least once every 8 hours. And that is for the most accurate performance of that continuous monitoring, so that it can give you accurate waveforms. Many times you'll see reports and they're missing 8 hours of the day, and that's due to lack of scanning for the Libre 2 and below. So making sure that they scan at least every 8 hours, breakfast, lunch, dinner, and prior to bed is what we recommend as least amount of scanning. Obviously, you shouldn't reuse scanners, and it's almost set up so that you actually can't do that. But it is also another stuff. Can a sensor break inside your body? And it says to call the healthcare professional. That's per Libre. And if you can believe it, I actually had that happen. The patient felt like they got the monofilament of a Dexcom in his arm. He likely did not. It probably fell out, but it was a little bit of a to do when he was worried about this little tiny filament that could be in his arm. So it is possible, and they should contact you if they're concerned about that. Next slide. So other things that you should know is that we said, even though you have the CGM, people still need to have a meter available to you. Know that there can be off. And as I said, 20 milligrams per deciliter within a blood sugar reading is actually considered accurate for the Libre, and know that it can be more off during rapidly changes in blood sugars due to exercise, eating, insulin dosing, those types of things. This system is not used for less than 4 years of age. Per Libre, it is not to be used for pregnant people, but we do this all the time. And it's not that it can't be, it's that they've never tested it on pregnancies and have the data to use it. But we certainly use Dexcom and Libres with pregnancy. Dialysis patients, this is also something that it's not been tested for and approved with. One of the reasons that dialysis patients is many of them are critically ill and dehydrated. So sometimes the CGMs just aren't as accurate on patients that have low GFRs. Prior authorizations, if they do have CKD4 and sometimes 3, some of these insurances will not cover it because it's not approved, and it's stated in their handouts and their sheets that it's not for the dialysis patient. So we do use them again, and they are off many times, but they also help a lot when we have some hypoglycemia unawareness going on. So again, it's mostly a not studied thing, and it's many times hard to initiate, but if they have it, many times it doesn't get taken away. It says to watch with implantable devices. I don't know, ask Dr. G if she's ever had any problems, but I've never had problems with pacemakers and ICDs and don't even really consider that. But that's something that the Libre company, again, has not proven through study and research that it's okay. Vitamin C is another thing, and I always get this confused. I thought I wrote some notes to explain. So vitamin C lowers it. I can't remember. But vitamin C over 500 milligrams is stated that it can change some of the blood sugar readings. So multivitamins is probably the biggest issue of patients that routinely take a multivitamin that has vitamin C in it. So, but it's saying over 500 to up to 500 is safe. Over 500 milligrams of vitamin C is something that they could potentially have off readings. Salicylic acid is another thing, which is found in aspirin, but more in skincare products. And it can make your products or your continuous reading sometimes off as well. And maybe not consistently, but they've seen higher blood sugar readings with that. X-rays, MRIs, CT scans, and anything that those treatments, diathermy, which is raising your use of heat. So any of those types of situations that go on will likely ruin your Libre monitor, and it will not prove accuracy after it's been scanned or has gone through any of these machines. So the recommendation is to remove it prior to having these tests done. Next slide. So this is my slide that's comparing all of these Libres, Libre 2 versus the 3 versus the Dexcom. I chose the Dexcom as a comparison because Libre 3 is the most like the Dexcom, and the Libre 3 is the newest Abbott device that's out that no longer requires scanning. So Libre 2 and Libre 3 are CGMs that connect to the phone. They actually do not have receivers. So the Libre 2 and Libre 3 system, they have to be compatible with an Android or an Apple phone. Most of the way how I determine this is I just have patients try to download the app, and if they can actually get the app to download on their phone, then it is usually compatible and we can get them hooked up. So, but there are not receivers that they can actually carry outside of the phone. Dexcom does have a receiver, so that's a benefit of that if they would not want to be utilizing their phone to see their continuous glucose readings. The sensor lifespan, I've already said this, is 14 days for the 2 and the 3, but the Dexcom is only a 10-day sensor wear. Alarms, this is something that's changed through the Libre 3 that has the most amount of distance that you can be away from your phone. So the other two are 20 feet, and Libre says an unobstructed. So unobstructed to them is leaving the room or having a wall between you, or likely going upstairs to downstairs. As long as it's unobstructed and you're within 23, the Libre 2 will function. Libre 3 is within 33 feet unobstructed. And Dexcom's a little bit different. Theirs is within 20 feet in less than 30 minutes. So as long as you could go upstairs or downstairs, but you need to get back to your phone and or receiver within 30 minutes in order to not lose waveform and alarms. Warm-up periods are a little bit different. Dexcom is longer at 2 hours. Affordability, they all tout affordability, but Libre 2 and Libre 3 are through pharmacy benefits and usually are the more affordable versus the Dexcom and Medtronic. Glucose frequency, Libre 2 and 3 monitors it every minute versus Dexcom is every 5 minutes. So that is a benefit for many. Calibrations, there are none. The reason I have Dexcom, I have a little asterisk there, is there is a code that the patient needs to make sure matches on their transmitter. And as long as it matches, there's no calibrations needed. So calibrations are when they have to do blood finger sticks and basically enter them in to a system to get the CGM to line up more accurately. So there is none anymore for Libre 2, 3, or the Dexcom. I've already said that they all have alarms and alerts, and they are water resistant. So showering is fine. Getting into pools for short periods of time are fine, and they are tested up to 3 feet. Next slide. This is just a little bit on the Dexcom, just to show you some comparisons, and I've stated most of these, so I don't have to go through a ton of it. But the Dexcom is used to have an acetaminophen issue as far as affecting the blood sugar readings. That's not it. I've already said no calibrations. Remember, we say no calibrations, but always remember if someone is low or has a low reading but doesn't have symptoms, then they should always be double checking for confirmatory low blood sugars. The blood sugar readings I said on the Dexcom is every 5 minutes. So still 288 readings per day that you don't have to scan for. So remember the Libre 2, you're scanning every time to get a blood sugar reading. This is just basically turning over your phone, turning over your receiver and looking at it, and there is your blood sugar reading for you. The other thing with Dexcom is this one does go to the iWatch, so that's convenient for many of our patients. I see a lot of type 1s using this, and it can connect up to 10 other devices for sharing capability. Libre 3 will also have this sharing capability, and that allows for very common for spouses that want to know patients' blood sugar readings. Definitely in children where parents are connected and they can see their blood sugar readings of their child. And then there's the connectivity that we have to our clinic. That's a little bit different because that connectivity is not that we look at them by the minute like you would as you were connected to a spouse's phone or a parent's phone, but this is for us to have reports. Dexcom, it works in communication with the Tandem and the Omnipod, and that is, as I discussed in the beginning, where you have the algorithms, and these pumps are having algorithms and basal insulin rates change per the CGM readings. And then lastly, I said there's no charge for the transmitter, and the battery life is 3 to 6 months, so that's a benefit for many people. And then on the right is just some pictures where you see the phone. The Dexcom is not round. It is actually more kind of an oval looking. It's the picture there. It's at the very bottom. It has like the purple edge to it. And that device there with the little orange knobby is the inserter. The receiver's there and just an iPhone. So that's kind of what it all looks like. Next slide. And then this is the Medtronic Guardian Connect. So have not spoken very much on this one. This sensor wears only 7 days. So the least out of any of these CGM monitoring systems. It does have the readings every 5 minutes. This one does require calibrations, but the newest Medtronic that is coming out with this 770 and the new sensors actually is getting rid of that. And this specific Medtronic Guardian Connect device here is only available through an iPhone. It actually isn't working with a Droid or anything like that. So if you're just doing the sensor outside of the Medtronic pump, this sensor needs an iPhone. So there is also links, I didn't say this on the Dextrom, for the providers reports. They're called I get these confused. Clarity is Dexcom's reports, and then Medtronic has the care link for providers. So the Medtronic sensors are not compatible with any other insulin pumps except for the Medtronic pump. And so you can see what that sensor looks like. It kind of looks like a little bubble. And that's all I have, unless there are questions. My next page, I think, is just references. And I will take any questions.
Thank you as always, Melissa. You always do such a wonderful job with this presentation. It's crazy how many different things there are and how much goes into it. So we really appreciate it. Any questions or comments? I know we had a participant hop on. I think she had to leave for clinic starting soon. So I'll see if she
Go into affordability for you all, because it is crazy on cost. It just depends on people's insurance and deductibles. And Medicare and Medicaid are always changing their rules as far as who can have them and who can't have them. So I didn't go into that because it gets tricky on each sensor as well. Dexcom is Medicare approved. Medtronic is not. The Libres are Medicare and Medicaid, but they have to be on insulin, and it just gets really tricky. So I always try to say to providers to just attempt it and tell the patients we'll see what we can get. And that's really the best way. Even my dialysis patients, I don't make any comments and say, hey, they might not approve it because you're a dialysis patient, but we'll try and see what comes up and what prior auths need done and that type of thing. So cost it just really depends on the patient and what their insurance is.
Absolutely. That always gets tricky. I can imagine. Amber or the team, did you all have any questions or comments, even not necessarily questions, but maybe if you come across a patient who requires CGMs and maybe coverage for them, feel free.
We're doing fairly well. Of course, we get back information when we try to get certain ones approved, and just have to go. Sometimes they have to show their logs for 3 to 6 months or different things, but it's been working pretty well.
Nice. Thank you so much for that feedback, Amber. I'm glad to hear it's been going well. Any other thoughts in the group? And if either of you have any colleagues or anyone who is interested in joining Echoes for Endocrine, please let us know, because we do love having that discussion and having folks ask questions or sharing their experiences as well. That would be awesome. All right, if there are no other questions, big thank you, Melissa, for taking the time to put that presentation together. We really appreciate you and sharing your expertise with us, as always.
Thank you. No problem. Thank you.
Yeah, and the only announcement that I have is that the next session actually on November 23rd will be canceled for Thanksgiving. So the next time we'll meet is on December 14th, which is crazy to think. And Dr. Kumar will be presenting on thyroid diseases and treatment. So we look forward to seeing you all again next time. Thanks again, Melissa, and thank you all for joining.
Thank you.
Bye. Bye.
Thank you.